Hello, my name is Eric Teneng, and this presentation is titled Regulation of APRN Practice Drawback to the Vision 2030 Healthcare System. In 2011, the U.S. Institute of Medicine presented a report titled The Future of Nursing, in which it presented a vision of a transformed healthcare system by the year 2030. Accordingly, the transformed healthcare system will witness a shift from acute care to primary care. That is, primary care or primary prevention will supersede acute care, which is characterized more by secondary and tertiary preventions. And for this to happen, nurses, especially advanced practice nurses, will have to play a preeminent role in the new healthcare environment. Thus, the Institute recommended that advanced practice nurses should be allowed to practice to the full extent of their education and training and should pursue higher education in all domains of nursing. And at this point, the issue, which is the purpose of this paper, is the fact that 13 years after the recommendations were made, Healthcare Vision 2030 is still at risk due to regulatory limitations to the scope of practice of advanced practice nurses. An analysis of the situation indicates that APRNs cannot practice to the full extent of their training and education when state and federal regulations restrict their scope of practice. At the moment, there are three types of practice environments. The first is states with full practice authority, and there are 26 states with full practice authority. In this state, nurse practitioners can assess and diagnose patients, order and interpret diagnostic test results, prescribe and administer non-scheduled and controlled substances. However, the catch is that Medicare and Medicaid services do not recognize services provided by APRNs in long-term care facilities and in skilled nursing facilities, except these services were performed within a collaborative agreement with a physician. The second practice environment is marked by states with reduced practice authority, and there are 13 states with reduced practice authority. In this state, APRNs may practice autonomously, but they are required to have a collaborative agreement with a physician in order to be able to prescribe controlled substances. And the third environment is known as the restricted practice authority. There are 11 states with restricted practice authority, and in this state, APRNs practice under a career-long agreement of supervision with a physician. The implications of these restrictions are wide-ranging. A study by Klenpel and others in 2021 indicated that due to the limitations, 33% of nurse practitioners experience restricted home health approval for services they performed. 32.8% experience restricted hospital admitting privileges. 30.4% were required to have a physician's signature in order to place orders for durable medical supplies. 22.9% were required a physician's co-signature to place healthcare orders. 19.6% of the respondents suffered restricted insurance for their healthcare credentials, and 16.4% of the respondents said that they were required to have a physician's supervision in order to perform or conduct procedures within the APRN's scope of practice. The consequences of these limitations are many. Prime amongst these consequences is the fact that Vision 2030 healthcare may not be attained. Healthcare will have to remain focused on primary or on acute care. That is, healthcare will remain focused on acute care instead of primary prevention and preventative care. Also, the cost of healthcare will be high as the physician reimbursement rate is higher than that of the nurse practitioner. Equally, access to health care will be limited. It should be noted that nurses constitute a huge part of the labor force in healthcare. In fact, there exist about 385,000 nurse practitioners in the US at this time, providing safe, efficient, and cost-effective care to patients in both rural and urban settings. So, restricting their scope of practice would render healthcare unaffordable and even inaccessible. In summary, there are 24 states which still have reduced or restricted scope of practice for nurse practitioners, and this makes healthcare more expensive and less accessible. And this limitation of the scope of practice of the nurse practitioner is the biggest barrier at this time to attaining the Vision 2030 healthcare as presented by the Institute of Medicine in its report on the future of nursing. Here are some questions for further discussion. NPs in healthcare focus their attention more on acute care. How therefore is it argued that if nurses are given a prominent role in healthcare, it will lead to more preventative than acute care? Also, considering that Medicare and Medicaid services or services regulations do not accept services performed by APRNs, can it therefore be said that the federal government is against nurse practitioners gaining full practice autonomy? Well, thanks for listening.